Okay, you can begin whenever.
Alrighty. So, as you can see in the first slide, that is me in the pictures, but not only me. My father, he's also in the pictures. My father was diagnosed with alcohol cirrhosis in 2013. He struggled with alcohol abuse and did for many years. In 2013, I was 12 years old, or 10 years old, and I didn't really understand what was going on or what exactly it was. I was very young and I didn't really understand why he was sick. And he ended up passing away in October of 2018. So this is what I'm going to be doing my speech on, is alcoholic cirrhosis. So what exactly is alcoholic cirrhosis, you may be asking? So according to the epidemiology of alcoholic liver disease, cirrhosis is where scar tissue replaces the normal liver tissue, disrupting the blood flow through the liver and preventing it from working properly. So cirrhosis has a huge impact on a person's health and can cause a great amount of problems if your liver isn't working properly. For alcoholic cirrhosis, I will be discussing the background on what cirrhosis is, then I will dive into how it is developed and what symptoms come along with the development of alcoholic cirrhosis. Lastly, I will talk about the treatment options for alcohol abuse and alcoholism, dealing with cirrhosis, and then leading into the prognosis of when you are diagnosed. So as I mentioned earlier, alcoholic cirrhosis is scar tissue replacing the normal liver tissue, disrupting the blood flow through the liver and preventing it from working properly. When it comes to cirrhosis and alcohol, the amount of alcohol you take into your body has a negative impact, leading to the development of alcoholic cirrhosis. So in this picture, you can see that the first picture of the liver, that is a healthy liver. And as you can tell in the second picture, that one is when you have developed alcoholic cirrhosis and it becomes very inflamed, enlarged, and it's not healthy looking at all. So according to Stephen Reinberg from the Consumer Health News, found a new study stating that deaths from alcoholic cirrhosis have tripled over the last 20 years. And this article is from 2022. In 1999, it was 3 per 100,000 Americans, and by 2019, deaths skyrocketed to 11 per 100,000 Americans. There's been a large increase in alcoholic cirrhosis in the ages of 25 to 35, both male and female. Dr. Charles Hennekins, senior academic advisor to the dean at the Charles Schmidt College at Florida Atlantic University in Boca Raton, said, "People are drinking more and starting earlier in life. Therefore, we are seeing an increase in alcoholic liver disease. So you see the development of cirrhosis starting to begin at an earlier age." To clarify, alcoholic cirrhosis develops from the amount of alcohol intake. According to the epidemiology of alcoholic liver disease, the higher amount of alcohol you consume, the higher chance you have of receiving alcoholic cirrhosis. Reinberg said the average amount for a male to consume in a day is 2 drinks, and for a female it is only 1 drink a day. When you're consuming more than the average drink, your liver starts to have a hard time breaking down the alcohol. Then your liver can take, and that's the start of alcoholic cirrhosis. Consuming an excessive amount of alcohol is also known as alcoholism or alcohol abuse. So in this chart, it says the alcohol consumption is like the grams you should take per day. And the more grams that you take, the higher risk. You can see like how the graph like skyrockets, like because you're taking too much alcohol into your body. So, and alcoholism is the main reason on why you would develop cirrhosis, because the more you drink, the higher your tolerance becomes. And the higher your tolerance becomes, the more alcohol you take in, because you're not being affected in the ways like you would be if you had like 3 drinks. Okay, and then some of the symptoms of that you will begin to notice is redness of palms, shortening of muscles in the fingers, and like white nail, so your nail bed will be like white. And like internal symptoms would be your enlarged liver, or if it's like inflamed, as I showed in the second slide, of the liver being very large compared to a healthy liver. And then when you have a late stage of cirrhosis, you would develop jaundice, which in this picture shows a guy who's healthy on the left side, and on the right side, you can see he's developed jaundice, and that's just the yellow tone in your skin. And then you can also develop the gastrointestinal bleeding, which is known as like bleeding internally, or like if you use the bathroom, you're bleeding, or if you're vomiting, you're bleeding vomit, or like you're vomiting blood. So with treatment and prognosis. So when you're diagnosed with alcoholic cirrhosis liver disease, it all depends on the severity of your cirrhosis and if you choose to be abstinent from alcohol. According to the epidemiology of alcohol liver disease, your prognosis is a 5-year survival rate for the early stages of alcoholic cirrhosis. If you have an early stage of cirrhosis and you choose abstinence from alcohol, it's still 90% effective that you will last that amount of time. Not choosing abstinence you lose 20%, so you only have 70% of it being effective. In the late stages of cirrhosis, say you catch cirrhosis later and you didn't realize you had it, but you're in like the deep stages of it, your survival rate is only 60% if you stop drinking. And if you choose not to stop drinking, then it's only 35%. And then in the early stages as well, if caught early enough, it can be treated only by abstinence, because the liver is an organ where it can regenerate itself and restore itself and be able to be healthier than what it once was. And then for late stages of cirrhosis, it can only be treated with a liver transplant. And 1/3 of liver transplants given are mainly for alcoholic cirrhosis. So 1/3 of transplants are mainly for people who abuse alcohol and have cirrhosis. However, there are some treatment options for alcoholism and alcohol abuse, such as residential treatment facilities, outpatient clinics, and also AA meetings or Alcohol Anonymous meetings. Basically, it's a group of alcoholics who come together and meet, and they talk about their struggles with their addiction, and they kind of explain like what they can do to get past that and what will help them. So that's part of it. And in this picture, it just shows if you were to get a liver transplant, you would only take a portion out of it, and then so that first portion, the first picture, will only be part of the second one. So your liver, when you get a liver transplant, you only get like a portion of it. And then, so I guess in the end of it all, alcohol cirrhosis of the liver can be prevented with abstinence of alcohol. First, I discussed the background of what alcoholic cirrhosis is, and as a reminder, it is where scar tissue replaces the normal liver tissue, disrupting the blood flow through the liver and preventing it from working properly, therefore affecting the development of the liver, causing alcoholic cirrhosis through alcoholism and alcohol abuse. In addition, I showed what physical symptoms and what internal symptoms can appear throughout the development of cirrhosis. Depending on the stage of your cirrhosis also depends on your prognosis and if you choose to be abstinent from alcohol or not. Lastly, I listed some options about treatment for alcoholism and alcohol abuse and what can and cannot be treated depending on the stage of your cirrhosis. Most importantly, the severity of alcoholic cirrhosis has a huge impact on the person's health and can cause a great amount of problems.